Right, off to our first speaker. I'd like to welcome Anna Love, who is the Chief Mental Health Nurse and Head of Safer Care Victoria, to come and talk to us about the Equally Well strategy so far in Victoria. Anna has trained and worked in the UK before moving to Australia and was appointed as Victoria's Chief Mental Health Nurse in 2015. Anna's vision is to ensure that we have a skilled, valued and nurtured mental health nursing workforce. Today, Anna will be providing the forum welcome. Thank you very much, Anna. Thanks very much.
Hello everyone, and welcome to Melbourne. I'm sure yesterday I know that you had a great day. It was unfortunate I couldn't join you, but I know Minister Stitt did the opening, but welcome. I first want to acknowledge country. I think taking time at the beginning of the day to do our acknowledgements is also a bit of grounding that we actually have. So I just want to acknowledge the traditional custodians who have lived and loved this country through the vastness of time. And I honour the Wurundjeri people of the Kulin Nation whose country I stand on today. I pay my respects to the old people, to the elders and the ancestors who are the safekeepers and caretakers of the oldest living culture on the planet. For this is the very bedrock of this place, our shared home and our special identity in the world and the source of shared pride as Australians. For this land always was and always will be Aboriginal land. I also recognise people with a lived experience of trauma, neurodiversity, mental ill health and substance use or addiction, their families, carers and supporters. And my appreciation extends to the clinical and non-clinical workforces that support people with a lived experience. To create healthcare that serves everyone, we need to include everyone. And we are here working together to allow for contributions of people from all cultures, genders, sexualities, bodies, abilities, spiritualities, ages and backgrounds. So I thought I would start the journey here and the welcome to Melbourne with a bit of a descriptor of what's actually happened in Victoria. Because as you know, we've had the Royal Commission into mental health. And with the Royal Commission came some changes in structures around safety and quality, and new entities have been stood up in relation to safety and quality around mental health. And this fits with what we're discussing today because Equally Well is one of the pieces of work, the policy statements, the practice that in my position, I'm trying to lead across Victoria and actually make changes for everyone in the area. So what you have in front of you here is actually the new entities. So we've got the reconstruction of the Department of Health, which actually saw the move of my role as Chief Mental Health Nurse. I used to sit alongside the Chief Psychiatrist. I moved into Safer Care Victoria. Safer Care Victoria is our safety and quality agency in Victoria. It was established in 2017. And prior to the Royal Commission, mental health had not been a focus for the Safety and Quality Agency. It had been actually safety and quality issues had sat with the Chief Psychiatrist. So with the Royal Commission, my position moved to Safer Care Victoria. And with that, I took a team with me to establish what has now become the Mental Health Improvement Programme. And why is that important? Because it brought lived experience clinicians together to work with the sector around improving practice and improving the services that we provide in a way in which we've never been able to do before, which I'll talk to a little bit later. And also, by my position going into what is now called the Clinical and Professional Leadership Unit, I actually am the Exec Director who sits alongside and works with the Chief Medical Officer, the Chief Nurse and Midwife, the Chief Paramedic, the Chief Allied Health Officer, So it brings together those voices right across health so that we can actually together make a difference for everyone. So instead of mental health being sitting off to the side in a silo all of its own, it's now seen as part of health and part of the way in which we actually think about our work, which was an important move. So the Mental Health Improvement Programme, it was a recommendation, as I said, from the Royal Commission, and it was there to improve healthcare in Victorian public funded mental health services, making them safer and more effective, appropriate and connected. Now, we sit within Safer Care Victoria. We reach into health services around improvement activities and recommendations, but also practice. So we work in partnership with consumers, carers, families, supporters and the mental health and wellbeing workforce and content knowledge leaders to partner with quality improvement programmes. And I think it's the partnering that is really, really important. And as you will see as I progress through this presentation today, about how the partnership is actually fundamental to how we actually can do our work. So the aim of the improvement programme, as you can see, was to ensure that we actually could provide safe and quality services, mental health and wellbeing services. And we do that through leadership, we do that through capability, and we do that through improvement. In the leadership space, there's lots of discussions around actually and with leaders across the state, both from a lived experience perspective and clinical perspective. We have many communities of practice that come together, leadership groups with the full intention of always talking about practice and practice changes that we can make, which will improve the services that we provide. Building the capability, though, of our workforces is key to this, and a number of frameworks which we've developed prior to actually moving to Safer Care Victoria have come along with us. So we continue to do work around mental health intensive care, around safe wards, around clinical supervision, and Equally Well in Victoria, which is a key part of our frameworks and capability building that we're working with the sector with. And then improvement. How do we make changes? We do that through improvement. And improvement in the way in which we do it is actually we do it step by step in small steps with the sector in a way which they can actually take it on and actually make the changes that are actually important to them, important to you. Because there's no point someone saying you need to do X if X is not going to fit with what the service is or the capability of your workforce or your need of your client group. So as we come together with the Mental Health Improvement Programme, the Chief Mental Health Nurse role and the Clinical and Professional Leadership Unit, we're actually coming together to develop and implement clinical guidelines and standards, responding to issues that raise an opportunity for improvement. So we don't just think about just the Royal Commission recommendations. We're constantly hearing and seeing things that are actually happening in the sector. We're looking at data and actually responding to that. A piece of work, for instance, and just to say, I won't go into this any further than just to say the words, but we are doing some work around ligature, and we saw that as a need. There was a need in the sector for us to do some work in that area, so that's what we're doing. So we're doing some improvement work with the sector around ligature and ligature assessment. We're actually building the mental health workforce capability through support and development, and that's through many ways in which we do that, through communities of practice, through continually sharing in our learnings that we're actually having across the state in all the work that we do, and also working with our workforce teams. Now, Victoria has the capability framework, which actually sets out what are the base capabilities that we expect of our workforces, whether you're clinical or non-clinical. What do we expect from you if you're going to be working in the wellbeing services? We're developing the Mental Health Learning Network, which is in simple terms, it's a way of communication. It's ensuring that anything that we do is recorded, that we've got webinars going out, we've got specialty areas that we focus on. We get key people from international speakers as well as national speakers to talk about particular items that we're actually doing work on and sharing their learnings. And through the work that we do at Safer Care Victoria, we have a big connection through IHI, the International Health Improvement Agency, and we use their methodology for the improvement, but we also use their leaders across the globe to support us. So we're continually talking to the UK and to the USA about the work that they're doing in mental health as well, and in health. The most important piece of our work, though, is the way in which we do it. The ways of line, no blame, power equalising, and all share, all learn, and it's safety for all. Everything that we do needs to be safe for everyone. There's no point making changes or improvement to the ways in which we practice our work unless it is safe for everyone. So you all know, because you are here today, that people living with mental illness have a poorer physical health, yet receive less and lower quality health care than the rest of the population. Here in Victoria, we actually developed, as a response to the consensus statement with the Commonwealth, we actually developed the Physical Health Framework for Specialist Mental Health Services. And it was there to support our mental health services to make decisions about developing, implementing and reviewing policies, procedures and programmes that help consumers to make decisions about addressing physical health needs. Now, the services out there, and I can see many of you in the room, you know, I always say, I don't come with money, because I don't. The work that we do around improvement comes with resources, as in people, to help support, but we don't come with funding to help produce new positions, etc. in the sector. But what I've been buoyed by is the fact that since we launched this framework, despite the fact that we haven't been able to say, here's some money for a project officer in your health service, we will help you fund, the sector have actually brought this framework to life on their own because they've seen how important the work actually is. So this framework, it applies to all Victorian specialist mental health services across different practice settings and all ages. And the framework is intended to complement existing professional standards and related practice frameworks and adhere with the Health Practitioners Regulation national law regarding scope of practice for health practitioners. So it's there to support the work that was already happening in the sector, but actually to say we can do better and why not focus on particular areas. And the QR code is there for anyone that wants to have a look at the framework. So this was the model of the framework, which was developed with consumers, carers, clinicians over, actually, it took us about 18 months to develop the framework at the time. And as you can see, the consumer is absolutely central to everything. And it's about what the consumer's needs actually are. And we think about the healthcare setting, we think about the collaboration of therapeutic interventions, and we think about the workforce that's required and what wraps around that. So the domains of the consumer physical health needs, collaborative planning and therapeutic interventions, the healthcare setting, the workforce considerations, and supporting safety for everyone. And I think continually that narrative of supporting safety for everyone is really, really important. The 8 priority areas, which are now under review as we look at the national data, they were 8 priority areas at the time that the group that came together saw as the ones that they really wanted to focus on. And they're still absolutely relevant. But the data released just recently will actually give us a further look at, are these areas relevant? Are there areas that we need to add? We've already been talking about cancer and about whether we need to add some thinking about what we do about cancer and cancer screening here in Victoria for people with mental health issues. So there'll be, I think, further discussion around that. The framework didn't talk to age, and it really didn't talk to our youth. And we've had some initial discussions with a number of our nurse practitioners and lived experience colleagues who work in that youth space about whether we should actually be thinking about a particular element of the framework that actually talks to youth. So I think those certainly will be a couple of areas that we'll be looking at to develop. So we support the implementation of the framework, and as I said, we do that by bringing people together. So the physical health and mental health training, which CMHL have been doing now for a few years, that has been a great support of the framework in a way of actually bringing it to life and reminding our staff about, what they can do, simple things that they can do to support this. We've had clinical guidelines, which include smoking cessation guidelines, and we're now in the process of reviewing that again as we think about vaping. Medication safety and mental health, the Australian Commission of Safety and Quality in Healthcare put out some guidance around that. We've got the national standards that we still obviously adhere to and connect with, and the framework for recovery-oriented practice in Victoria and how that's connected very much to this framework, because the framework is saying you listen to the consumer. It's their recovery journey. So this is part of the recovery journey, is actually understanding what their needs are, what their wants are around their physical health. Who am I to say that you should lose weight? Who am I to say that you should stop smoking? You need to know and want that yourself. And we support you. And that's what this is about. We also started with a community of practice for nurse practitioners, which has been a wonderful community of practice that has grown and developed over the years of nurse practitioners who have dedicated their work to working in the mental health sector, but actually focusing on physical health needs. And they have developed many different programs, which I'll mention in a moment. So we do this in Safer Care Victoria. We do have a team that actually have this as a portfolio, and Rebecca Helvig, Kia Saltmarsh, sitting over here to my left, are part of that team that drive the changes that need to happen. We also have senior nurses who come together to do some leadership in this space too, and I just want to call out Harry over here from Eastern Health, who's one of our senior nurses in Victoria, who's been a key driver actually in the changes that are being made within Victoria and within our health service. So we're leveraging our positions within the CPLU through clinical craft groups and leadership, the guideline development, and looking at ways in which we can partner more so that we actually bring this right across health. We're looking also about how we apply the improvement science that we use in improvement, the IHI methodology, to support the work that's actually happening in Victoria so that we can scale and spread, that we can monitor things, small bite-sized pieces of improvement, that we can actually start seeing whether there's change actually happening in the system. We're developing a resource sharing platform for all services, and we're working with the CMHL, Centre for Mental Health Learning, and the Centre for Mental Health Nursing, retraining gap analysis and support of the delivery of more training around how we encourage people to think about physical health. And connecting people with ideas. So people and ideas coming together, and really communities of practice, that's what that's about. It's about how do you share what you're doing, how do you learn from others so that you can actually take that forward in your services. So we also have a developing a statewide working group, which is a collaborative space, which is on the ground relationship building and valuing the knowledge and expertise. And that's actually where bringing the leaders from a lived experience and also from this clinical sector together to talk about what's next. Where do we go? What's next? And that's where we will be looking at the data that has been released around what are the things that we need to focus on here. And we're also now hearing from services that it's often remaining, unfortunately, in the domain of nurses, but there is a drive to move the physical health thinking to other disciplines, because we know that all disciplines have a role to play. And in our busy lives, it's just finding that space for us to be able to have those conversations too. So again, the importance of lived experience in the workforce, the collaboration and the value of sharing that space together. We have to continue to do that. And the Mental Health Lived Experience Engagement Framework encapsulates the importance of co-design and co-production. And those are the principles in which we actually do all the work in this space, that we actually are doing that together, bringing that together, collaborating together. So good health, as it says, and well-being is broader than the clinical medical model definition. And we have to have a deeper understanding of what that means. And that's where we need to listen to those who are within our systems. So we need to listen to lived experience and living experience. We need to be responsive to the communities that can provide real-time feedback and actions. So it doesn't all have to sit within the mental health programmes, the mental health and wellbeing services, but we need services that are fit for purpose, holistic, accessible and safe initiatives and interventions. It doesn't all have to be the medical model. We need to rebalance power. We need to be listening and rebalance the thinking of where the power lies and addressing the stigma that is still there, unfortunately, for those that have mental health issues and also want to seek out physical health requirements. And, it happens, unfortunately, in emergency departments where people attend emergency departments for a physical health issue, but they've got a mental health diagnosis. And sometimes, unfortunately, things get missed. We need to make sure that that doesn't happen. We need to change the dialogue that actually happens in those spaces. I think it is happening, but it's slow. So we need everyone to work together to actually to bring that to life. So I just lastly want to just call out and give a call out to what's actually happening in Victoria. And this is not the list of all that's happening. And I want to acknowledge services that I haven't got on this list, like the Alfred, who I know got an award yesterday for the work that they are doing. Eastern Health, as I said, we've got a leader in Eastern Health of the work that they're doing, Harry Singh, who's with us today. And they're doing a very targeted piece of work about Equally Well, a programme-wide steering committee that they've established with reps from streams that meet every month. And they come together from adult, community, inpatient, rehab, older adult and child and youth. And they completed a gap analysis so that they could actually develop a local action plan. And that group that comes together is nurses, it's allied health, it's lived experience. So they've been looking at embedding specialist addiction services as embedding a service with a 12-month pilot programme to improve AOD supports to the inpatient unit, which will have an impact, obviously, on not only responding to those who have got addiction medicine requirements, but also to the physical health needs that come along with that. They've also now embedded a GP in all the 3 clinician community sites, primarily linked up with a CCT service, a continuing care team service, to support consumers who do not have well-engaged GPs in the community. And I think more and more, accessing GPs has become so difficult. I don't know about you, but trying to get an appointment with your GP, you have to wait a long time. You've got to know well in advance when you're going to need that appointment. They're employing dietitians into the programmes they run in the groups so that for inpatients, developing resources for education of staff and community teams on healthy eating and working on upskilling staff knowledge. So just some of the things that Eastern Health are actually doing. And they have future plans of things that they want to do, which would be to set up a clinic and partnering with Sexual Health Victoria to support consumers with sexual health screening and linkages. We've got the Royal Melbourne Hospital, who've got physical health-led nurse practitioner services. So services provided are face-to-face, telehealth, individual and group consultations, and outreach appointments are also provided. And the commitment from the team has resulted in excellent outcomes, and most recently was acknowledged as a highlight during the 2023 accreditation review that they had of their service. And some of the highlights included the establishment of the Hepatitis C clinic to promote awareness, screening and treatment for mental health consumers. And as of now, they provide treatment to 3 consumers who otherwise have fallen through the service gaps. And this has been made possible by obtaining funding for point-of-care testing machine and accessing free treatment through local community pharmacies. So real showing that if you bring the community together with our health services, the differences that you can make. The Breathe Easy Clinic, and it assists consumers in supporting smoking cessation, and this service is provided weekly and it's got improved processes for referral, have ensured easier access for clinicians to make referrals to the service. So just some of the things that they are doing. Northern Health, calling out Trudy Brown, who's been one of our leaders from a nurse practitioner perspective in Victoria around physical health. And she's a nurse practitioner working in acute adult inpatient psychiatry who's treating hepatitis C. She's also performing cervical screening, offering contraception and treating STDs. And it's well received by consumers of the service who have been unable to access these services in the community due to associated costs or lack of trauma-informed care available in the community. So unfortunately, that's when we actually are picking up a service gap, which could be picked up within the community. Southwest Mental Health, they are doing some great work. Nicholas Place and Kaylin Gleeson support primary care in the assessment and management of mental health disorders, in particular of the high prevalence disorders. Have a number of specialist programmes attached to their programme, including the perinatal emotional health programme, Clopine programme and the physical health assessment team. So just some of the experiences of theirs. Western Health, doing great work around with their nurse practitioner Ramesh, who I also see is here today. Lived experience worker is part of their working group, and further to the inclusion of peer support worker Voice. He's in the process of working with advanced practice nurses and nurses who are doing their nurse practitioner's pathway to lead physical health implementation. So that's actually about developing the workforce and building the need and requirement for to have nurses who are expert in this area. And they've also doing gap analysis, looking at the framework, thinking about the ways in which they can actually bring the work together. We've got La Trobe Regional Hospital. I could keep going on, where they've got intensive internal programme motivated by Equally Well, and it targets patients who have had 3 to 4 admissions in 1 year who would benefit from intensive therapy in the community, either mental health, physical health and or AOD. And they have 2 nurse practitioners, one who's also a diabetes educator and a mental health dietitian. And they actually do programmes with consumers who come from the community. So in short, there's a lot of work happening in our sector. There's a lot of work going on, but there's a lot more that we could do. And I think in Victoria, we are still committed to doing better because we can do better. I think the Royal Commission is providing us a framework more broadly about how our mental health services are now. And the fact that we have more and more lived experience colleagues working with us in our health and wellbeing services, it can only mean good things for the future. But we all have to keep our eyes on what we can do, things that we can change, and not accept that stigma is there, not accept that we get a worse service because we have a mental health diagnosis. Accept that health and health outcomes are there for everyone equally well. Everyone should have access to the same outcomes for their health. So I'm still committed to working in Victoria and supporting this work, and I can only do that because of everyone in the room here that's from Victoria and more broadly, as we continue to to make sure that the data is shared, that people know what's actually happening in our society, with our community, with our consumers and carers, that we're actually got a voice to talk about that, and that as clinicians that we are actually supporting the sector to make the changes. So thank you for listening, and thank you to all the services in Victoria for the work you do, and also thank you for the national group who actually have, keep fighting the fight, keep talking about what's actually happening out there for everyone, and sharing the data, because data is key. That's the key to actually making the change. We've got to know what the data is actually saying, because that's your experience, it's our experience of care, which is really important.